Cholesterol is actually a relatively complicated molecule. It's a building block required for all of our cells, and at the same time, in excess, it's a major component of plaque, which leads to the development of stroke and heart attack. When people talk about LDL, they're talking about bad cholesterol, the type of cholesterol that can incorporate into your arteries and cause plaque. If you have very little risk of having a cardiovascular event, you're allowed to have a relatively high LDL, up to 130, while at the same time, if you're considered a high-risk patient, you are only allowed to have an LDL of 70 or below. So high cholesterol really depends on the individual patient as opposed to a strict number that applies to everyone. All of our guidelines are based on LDL cholesterol. It's possible to have an LDL cholesterol of 100, yet have a total cholesterol of 240, and you can absolutely be fine and not require medical therapy. On the other hand, you can have a total cholesterol of 170, but if you have mostly bad cholesterol, very little good cholesterol, you may well require medical therapy based on our current guidelines. So you can't bank on just a total cholesterol. You need a full fasting lipid profile to determine your risk. HDL, on the other hand, is good cholesterol, and it's thought that the more HDL you have, the better off you are as far as cardiovascular risk is concerned. An HDL greater than 40 in men is considered to be normal, and in women, an HDL greater than 50 is considered to be normal. The higher the better in most circumstances. High cholesterol, unfortunately, is mostly a hereditary process. 75% of the cholesterol in our bodies is manufactured by our bodies, and we have very little control over that. However, that means that 25% of our cholesterol, particularly our LDL cholesterol, can be attributed to diet and exercise programs. Unfortunately, there are no real signs or symptoms to high cholesterol. The only way you're going to know if you have a high cholesterol level, especially one that requires therapy, whether it be by medical management or by lifestyle, is to have your blood checked. The best way to do this is to have a fasting cholesterol profile done. That would include a total cholesterol, an LDL, an HDL, and a triglyceride level. That will allow your physician to know whether or not you need lifestyle modification or perhaps even medication to address a problem. Our current guidelines for adults say that everybody over the age of 20 should have a total fasting lipid profile done. Family practitioners can do a good job at treating HDL, LDL issues. However, if someone has known vascular disease, in addition to cholesterol levels that are out of the set standards, then seeing a cardiologist may help them reduce their risk of a stroke or heart attack down the road. If an adult has a great-looking cholesterol profile, they do not have to check it more than every 5 years based on the current guidelines. That said, most of us don't have a perfectly normal cholesterol profile, and therefore you need to be checked more often. If you're on medical therapy, on average that ends up being about once a year. If you're being treated just with diet and exercise, you may decide to check it every 2 or 3 years. It really depends on the individual and their level of cardiovascular risk. Having high cholesterol is an individual risk factor for developing atherosclerosis and having a heart attack or stroke. It goes right hand in hand with high blood pressure, smoking, family history, and diabetes as some of the most important risk factors we have for developing plaque and eventually having a cardiovascular event. There are multiple treatment options for high cholesterol levels, and it almost always starts with diet and exercise. You can either go through your family doctor, through a dietitian, on the internet to determine what's best for you and your individual lipid profile. That said, we normally give people a maximum of 6 months of diet and exercise before we decide that they require medical therapy. If they can't achieve their goals within 6 months, we usually use medication, and for most patients, that means a statin to start with. Many of our statins, which are really the cornerstone of therapy, have now gone generic and more are coming to the generic fold here shortly and are much more affordable than they have been in the past. One really can't prevent high cholesterol if genetically you're destined to have it. However, we do have control over about 25% of our LDL levels, meaning that if you really crack down on your diet and really have a good aerobic exercise program where you exercise at least 4 to 5 times a week, at least 30 minutes at a time, you can drop your LDL levels by up to 25%. However, sometimes my patients get disappointed that they can't drop it further, but again, you're fighting your genetics and there's only so much you can do. There's no substitute for a regular exercise program when it comes to reducing risk, whether it be from risk of a stroke or risk of a heart attack. What you eat can really affect your cholesterol levels. Anything that has a rich, creamy sauce, those are usually loaded with cholesterol and loaded with saturated fat, which are the things we really want to avoid. I think the most important thing about cholesterol to understand is that it's an asymptomatic illness. You're not going to feel it. You're not going to know you have it unless you have it checked. Right now, times are tough all over, and a lot of patients have trouble affording medications, or for that matter, even affording tests or finding out if they're at risk for having a heart attack or stroke. St. Francis has multiple programs available that allow for free screening for cholesterol, blood pressure, and other risk factors that could lead to development of plaque and vascular disease. Talk to your family physician or your doctor at IHP to find out what's available for you.